Welcome to Beyond the Stethoscope, the podcast where we go beyond the charts and clinical rounds to hear the stories, insights, and heart behind the care at Trinity Health Mid-Atlantic. My name is Sam Bambino, and I'm your guest host for this episode. Today, we're joined by dedicated internist, Dr. Konstantin Ozerinsky from Nazareth Hospital, a vital part of the community and care team. He'll tell us what it means to be an internist, the challenges and triumphs of patient care, and how compassion and collaboration shape every moment of his work. Hi, Konstantin. Thanks so much for joining us today.
Nice to be here.
Great. To start, can you just tell us a little bit about your journey into medicine and what intrigued you about being an internist?
I started out as an engineer by training, and after college, while I was in college, I was doing biomedical engineering, so it was kind of a natural segue off of that. Went to Drexel around here in Philadelphia for med school, and did my residency training up in New York in the South Bronx. And then I came back here to work with Trinity, and I've been here about 5 years now and been happy with it ever since.
Very nice. For any of our viewers who aren't familiar, can you just explain what is an internist and just a little more about your role?
Yeah. So an internist is a doctor who trained in internal medicine who takes care of patients that are in the hospital while they're there. So the easy way I usually explain it to people is to say, well, if you go to the ER and the ER doctor says you need to stay in the hospital, the doctor you get after that will be an internist. There's a few different roles that we play for both the patients and for the hospital. If you think about 20 years ago how this was done, usually if you got admitted to the hospital, the doctor who would see you would be your primary care doctor. So the same doctor that you were seeing in the office would come into the hospital and see you there. That isn't the case nowadays so much. Now you'll be seen by a dedicated hospitalist or internist. And that person specializes just on inpatient medicine. So since it's all we do, we've gotten pretty good at it over time. So we coordinate the care for a lot of the patients. A lot of the complex cases that have multiple specialists, we're often the main point of contact for the patient because it's very confusing for the patients to have doctors coming in and out all day, specialists, therapists. And so we're the person that summarizes it all for them and explains it in a way that they can understand. Another thing that we do for the hospital system is we help offload from the specialists some of the work that they do so that they can focus more on what they're good at. So for example, if you're a surgeon, you have more time to just focus on surgeries and seeing patients. You don't have to juggle 6 or 7 other issues. We'll take care of that. And, the outcomes are usually better in these cases. If you look at hospital systems that have tried it in different ways, the best outcomes are always when you have a hospitalist, internist, taking care of the patient at the core.
Sure. Can you expand on that a little bit, just how having that internist benefits the patient and just adds to their experience?
Yeah. So when the patients come in, a lot of times, I, for example, very often see patients coming in from the ER. In the ER, the pace is very fast, and they're often confused about what exactly is wrong with them. What do their lab tests mean? What's the next step? What tests do they need? What consultants will they need to see? And more importantly, what is it going to look like after discharge? So we're not just looking at the inpatient part. We're an integral part of their continuity of care going even after their hospital discharge. So we'll set up all the specialists that they need to see. We'll make sure they get all the imaging that they need to get, and we'll make sure that they understand why these things are important so that they don't get lost to follow up.
Sure. Can you elaborate on that a little bit? Just what it's like coordinating with other departments throughout the healthcare system, for the benefit of the patient?
Yeah, so we coordinate, internists I think are unique in that we coordinate with pretty much every department in the hospital, from top down. We work with rehab, we work with the imaging department, we work with the lab, we work very closely with nursing, obviously. The specialists, we're in touch with them throughout the day. So from the morning when we come in, we're reaching out to nephrologists, neurologists, gastroenterologists. We're trying to get updates on what their plans are when they see the patients, and we're trying to communicate that in a timely way to the patient because the goal is always that when they're sent for a test or anything like that, it didn't come as a surprise. They know when the lab tech comes to draw your blood, you know what they're drawing and why they're doing it. When they take you to CAT scan, you know what they're CAT scanning and why it's important to do that scan.
Yeah, that's awesome. What would you say is the most rewarding aspect of your job?
I think the care that we give to the underserved patients that we have, in the area around Nazareth Hospital, we do have a significant uninsured, underinsured population. And for them, the challenge is always being lost to follow-up and not being able to get the outpatient care that they need. So even though in an ideal world, I would see a patient and then they would go on into the outpatient system and I wouldn't see them anymore. For some of our patients, we actually are their primary care doctors. Wow. They come to the ER, they may have to come several times a month even. And so we make sure, again, that there's no deterioration in their health, that they still understand everything that they need. And we really put in the extra time to make sure that we take good care of them.
Sure. Would you say that there's any challenges that you face on a daily basis or just, internists as a whole?
I think the challenges are probably the same that all of medicine is facing. I think every year there are more and more constraints of having to do more with less. And I think the biggest challenge is as you go through a busy day to recognize that you can't cut corners on the patient experience, right? So the part of the job where you're in the room talking to the patient is not the part where you can save 5 or 10 minutes. And in fact, investing those extra 5 or 10 minutes can pay off down the road because they won't have to come back, they won't have more questions later, and they'll have a better experience overall. And experience shows that if the patients are happy with the care they receive, the care is better, and the care team is happier about it too, and they feel like it's a more rewarding job for them.
Sure. How would you say you balance, because I always feel like it's kind of a balance in healthcare, sort of the clinical decision-making end of it, while also, showing that empathy and emotion with the patients?
So I always emphasize kind of bedside medicine. So whenever I get an admission from the ER, for example, I'll go right into the patient's room. I don't spend a lot of time chart checking beforehand. If anything, I'll open up the computer in the room with them and go over their results together with them. But mostly it's about getting the story from them. I think a lot of medicine, it's tempting to get the story from the chart, get the story from other doctors, and almost to kind of, I don't want to say ignore, but not talk to the patient as much. I definitely think the more you talk to them, the more you'll find out and the better care you'll be able to deliver.
Definitely. What would you say, because some days I'm sure your job isn't the easiest. What keeps you motivated and inspired to, do this every day?
The gratitude of the patients when, even when they're admitted, I've had several patients ask me, do you have a card? Can I see you after I leave the hospital? Unfortunately, I have to tell them, no, I'm sorry. I can only see you when you're in the hospital. But getting even the short time relative to what a primary care doctor would get that I spend with patients is very rewarding with me. And I think I've formed pretty meaningful relationships with them over the years, even if I didn't see them again afterwards. The other thing that's very rewarding, I think, is working with the nursing staff. Communicating with the patients is very important, but communicating with the nurses is also. The nurse is the person who spends the majority of the time at the bedside with the patient. And 9 times out of 10, before they call the doctor with any questions, they're asking the nurse. And so it's very important to make sure that we're talking to our nurses so that they know what to say when they're asked and they understand the care plan. So the same thing that I said for the patient is true for the nurse. If somebody's coming to do a lab test, the nurse should know why. If somebody's taken their patient to CAT scan, they should know why. And all of that kind of fits into, again, the patient experience and making sure their experience is a 10 out of 10.
Mm-hmm. Now, in your years of doing this, is there maybe one piece of knowledge that you've acquired that you would maybe want students to learn or anyone who's considering this line of work?
Yeah, I think it's to always be inquisitive and curious, to always be asking questions. And if you keep doing that, you'll always get the right answer. Over the years, what I've seen is if you just kind of do the lazy way of thinking, or if you cut some corners there, you'll run into trouble. But as long as you're curious about, why is the patient sick? How did they get sick? Why do they have a headache? Why is their stomach hurt? You keep asking why. I think that's the most important quality for an internist.
Sure. Okay. And final question, is there anything about internists that you think is maybe, misconstrued, or just anything that you want people to know about the job?
My parents still don't know what I do. I've explained it several times. I think probably the easiest way to explain it is how I did in the beginning, which is to say that what we do is we specialize in taking care of patients in the hospital and all of their care. And a lot of internists also work even in administrative roles, overseeing the hospital, and they're often uniquely suited to do that because of the background they had when they were doing bedside clinical medicine.
Mm-hmm. Was there anything else you wanted to add in?
No, I think just to say that, the patient experience is number one priority. Everything else goes from that, better staff retention, better staff satisfaction, better communication between the nurses and the doctors, better educational opportunities for the residents and for our nursing students as well. I think as long as we stay laser focused on, from the moment the patient walks into ER registration to the minute they walk out those doors, every part of that experience needs to be a 10 out of 10. Because I always tell the residents that, for us, we work in the hospital every day. So you get used to this. This is just your job. But for many of our patients, they'll remember this experience for the rest of their lives. It's going to be very memorable. And every little thing that happened, the way the nurse talked to them, the way the doctor explained things, were they cold when they got to the CAT scanner, how was the food? All of these things matter, and they'll carry them with me. So anything we can do to make that a positive experience is going to be good for their care.
Definitely. Well, thank you so much for joining us today.
It's great to be here. Thank you.
From patient care to teamwork, Dr. Ozerinsky's role reminds us that healing is more than medicine. It's connection, compassion, and the commitment to meeting the community where they are. If you would like to learn more about Nazareth Hospital and Trinity Health Mid-Atlantic's commitment to the greater Philadelphia community, please visit the link in the description below. Thanks for joining us on Beyond the Stethoscope. Be sure to subscribe and follow Trinity Health Mid-Atlantic on social media for more inspiring stories every other Thursday.